we had completed a study several years ago, and this was a different approach where we actually had drawn out marrow cells from patients with acute stroke. And after demonstrating that it's feasible to do a limited bone marrow aspiration in these patients, we then went further to actually image these patients over time, all the way up to 2 years after they had been enrolled in the study. And intriguingly, we had seen some interesting changes. We had looked at the white matter tracts of these patients that were enrolled in the study, and specifically we were looking at the corticospinal tract, those connections that come from the motor cortex that control the movement of our limbs. And so, what we saw was, as often is the case, these tracts often degenerate after stroke over a time period. But what was interesting to us was that we found that the tracts seemed to be coming back over time after 6 months. In many patients, we saw that the microstructural integrity seemed to be going back up. Now, of course, we don't really know why that's the case. It's great to think that it's because we see there's brain repair that's occurring, but this was a single-arm study. It wasn't a randomized trial, so we didn't have a proper control group. But we did make a comparison to another group of patients that were not enrolled in the study. And those patients did not show any evidence of repair or any evidence, I would say, that the tracts were getting better after 6 months. Many of them, they just continued to get worse, actually. Don't ever really get better. So it's intriguing data that supports the idea that it would be, I think, helpful in the future to be able to use imaging to maybe perhaps look at treatment effects on white matter repair. So this is maybe a new modality that we could use in the future to really look at even biomarkers of treatment effects of cell-based therapies for stroke or for other neurological disorders.